Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. Reminder after the pep talk is to take the online learning evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. I placed the link in the chat box. Another reminder, obtaining 25 OLETE certificates will entitle one mentee to a voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now and show your beautiful faces. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. May 17, 2025 marks the start of year number 5 for the ROJoson PEP Talk. How long the pep talk will last will depend on the enthusiasm, discipline, and perseverance of everybody. My pep talk today is entitled, How to Physically Measure Size of Surface Lumps. The empowerment objective is for the lay people to have a basic understanding on how to physically measure size of surface lumps in their health management. Contents of this particular pep talk will be the following. What is a surface lump? What is physical measurement of the size of surface lump versus laboratory measurement? Why is it important to know how to measure physically the size of a surface lump? What are the different methods of doing physical measurement of the size of a surface lumps and how to do them? Are size measurements using physical methods and laboratory methods give the same results? What are the quality goals in physical measurement of size of surface lumps? Disclaimer, the ROJoson PEP Talk contains ROJoson's thoughts, perceptions, opinions, and recommendations, or TPORs, culled from experiences of ROJoson and writings of other health professionals. Let's start with the first topic. What is a surface lump? One of the more common ailments afflicting human beings is a lump or a mass or a buccal noted on the surface of the body. A surface lump is any mass or lump or buccal that are palpated by the patient or a physician on the surface of the body. And a surface lump should be palpable at the minimum. It may or may not be visible through the naked eyes. Examples of surface lumps, masses, or buccal on, in, at the skin or skin level, underneath the skin, yet palpable, scalp, face, neck, breast, abdominal wall, back, inguinal areas or singit, scrotum, penis, introitus of the vagina, extremities. Here are some pictures of examples of surface lumps. Skin level, okay, on the skin, okay, on the nape, on the wrist, on the foot, on the face, on a finger. What if physical measurement of size of surface lamp? It is the measurement of the size of the surface lamp using a ruler, a caliper, or any improvised measuring device like coins and finger breadths of the examining person. It is a method that is perceived by the senses of the person doing the measurement. That's why it's called physical. In contrast, laboratory measurement is the measurement as gotten from diagnostic tests like ultrasound, CT scan, MRI, etc. Note number one, the size of a surface lamp can be measured both physically and using laboratory methods. Measurement of size of surface lamps usually start with physical method. This can be reinforced and validated by the lab method. Note number two, the results of physical and laboratory measurements of surface lamps may not be exactly the same. It is good enough if the results are approximately the same. Otherwise, the differences should be resolved. And note number three, theoretically, diagnostic measurements should be more accurate than physical measurements, as the former, meaning diagnostic measurement, uses more precise measuring devices, but not always. So at times, errors can occur even with the diagnostic measurement. Why is it important to know how to measure physically the size of a surface lamp? Number one, first reason, in anybody with a palpable surface lamp, one of the important baseline information to be gotten by the lay people and physicians is the size of the palpable lamp. This information is always asked by the physicians as part of their assessment of the lamp. This is part of the history and interview. The lay people should always be ready to have an answer when asked by the physician, anong size ng bukol mo? Second, the size of surface lamp should be measured and known as it can contribute to the diagnosis of the surface lamp. At times, the size alone of a surface lamp can give a clue as to its nature, whether it's benign or not cancer, or malignant or cancer. Although most of the time, other characteristics of the surface lamps are used to determine its diagnosis, like consistency, like mobility, and other findings. Third reason is that the size of a surface lamp should be measured and known as it can contribute to its monitoring, whether decreasing or increasing in size over time, either due to natural phenomenon, meaning without treatment, nawala na lang, or to response to treatment. Habang ginagamot, lumiliit. So, monitor yung size of the surface lamp. Monitoring the size of the surface lamp can also contribute to the diagnosis and staging of the disease, whether small or big, and early or late stage. So yung mga staging ng cancer usually is also dependent on the size of the lump. It can also help in the decision making on treatment, such as whether the lump is treatable or not. Kung malaking-malaki na, baka di na kayang gamutin. Whether immediate or urgent or non-urgent treatment should be done, etc. What are the different methods of doing physical measurement of the size of a surface lump? And how? Number one, use of ruler, caliper, coin breadth, and finger breadth. Ruler and caliper give more accurate measurement than coin breadth and finger breadth. The latter, meaning the coins and the fingers breadth, are used when ruler and caliper are not available. So using a ruler or tape measure like this, or a steep ruler made out of wood, plastic, and steel, using a caliper, using coin breadth, meaning placing a coin along the side of the lamp to estimate the size of the mass, just like this. So we must know the size of each type of coin. 25 centavo, example, 25 centavo coin will have a 2 centimeter diameter. 1 peso, 2.3, 5 peso, 2.5, and then 20 peso coin will have a 3 centimeter. So if the size of the mass corresponds to the size of the 20 peso coin, then that mass is about 3 centimeter in size. If it corresponds to the 25 centavo coin, 2 centimeter, then the mass is 2 centimeter in size. Using finger breadth is another method of measuring the size of the surface lump. So depending on the fingers of the examiner, some are thicker, some are bigger, some are smaller. So, but usually on the average, one finger breadth is around 1.5 centimeter. Kung dalawa ang finger breadth gagamitin that cover the mass, then it will be 3 centimeters in size. Illustrations on how to do physical measurement of size of surface of a surface lamp. So number one, important thing to remember is things to prepare for the measurement of a dominant breast mass palpated, or not just breast mass or any mass for that matter. You need the marker pen, then the measuring device, get hold of the ruler if it's present, then caliper if it's present. If not, then you can use coins which are readily available or your fingers. Preferably ruler, of course, because it's more accurate. Then number two, second thing to do is to outline the border or edge of the surface lump, like this on the breast. There's a breast mass here. Then measure the size in terms of centimeters using a measuring device, whatever measuring device that you want to use. So it can come out in as 1 centimeter, 3 centimeter, 2 centimeter, 3 centimeters, or 6 centimeters, depending on the situations. So this is an example using a stiff ruler. Okay. Measurement in centimeters in its widest diameter. So in this particular patient, 1, 2, 3. So the mass is 3 centimeter in size, in its width. Again, using a stiff ruler, this time if you want to measure the width and the height, so you put the ruler oriented this way for the height, then for the width, horizontally this way. So in this particular case, you have 3 centimeters as the width, and then for the height is 4 centimeters. So 3 by 4 centimeters. You can also use a tape measure or a fabric ruler. So first mark the edge of the or border of the mass that you want to measure. Then place the ruler, okay, but do not follow the curve of the mass because it will not be accurate. Then measure in centimeters, both in width and length. So this one is in width, and then the other one is in length. Use of a caliper. So first mark the edge or border of the mass. Then use the caliper to measure the size of the mass. Okay. Measure it in centimeters. Use coins if ruler is not available. So, but before you use the coins, you must first know the diameter size of the coin to be used. Place a coin or coins along the side of the lamp to estimate the size, like this, illustrated here. Then use a ruler to mark the edge of the border of a mass on the neck. Then place the ruler on the side or over the lamp, but do not follow the curve of the mass. Then measure in centimeters, this time in height, this way. Just look for the corresponding centimeters of this mass on the neck. Another illustration of how to measure the size of a mass on the neck. You can use finger breadth. This time, this is being done by a physician. So the physician locate the mass first on the neck, then place the fingers over the mass, then estimate the number of finger breadth covered by the entire length of the mass. So in this particular case, 2 finger breadths were used, okay, and the mass covered the 2 finger breadths. So Since one finger breadth is about 1.5, so times 2, 3 centimeters in size. Our size measurements using physical methods and laboratory methods give the same results? Or do size measurements give the same results? The answer is no. They usually are not the same. Theoretically, laboratory methods are usually more accurate as they directly measure the size of the mass inside the skin, like this. So ultrasound is an example of a laboratory method. So it measures this size of a mass at this level directly on the mass. With palpation or physical methods using fingers, because of the intervening fatty tissues between the skin and the actual mass, the tendency is to have a bigger size measurement, usually mas malaki. So what are the quality goals in the physical measurement of the size of a surface mass? Physical measurement of size of a surface lump is at best an estimate. I repeat, an estimate in centimeters. Even if it is just an estimate, it must still be done with accuracy as much as possible. Try your best, approximating the size obtained by the laboratory method, if there is one done. The measured size through physical means will usually not be exactly the same as that of the laboratory means. That's a given. So differences of plus or minus 1 centimeter are acceptable. Pwede na. More than this, there must be attempts to explain the marked differences. So remember, always strive for accuracy in physical measurement of the size of surface lumps. Physical measurement of the size of surface lump cannot be omitted by any physician seeing a patient with a surface lump, even if laboratory measurement can theoretically be more accurate. Kahit na may mga laboratory measurement na pwedeng gawin, the doctor will still have to measure the lump using physical methods. So there must be always a check and balance between the physical and laboratory measurements, as the latter, meaning laboratory measurements, can also there can also be error in the measurement, just as there could be error in the physical measurements. Check and balance. So with that, I finish my lecturette, okay, and I have presented the following: what is a surface lump? What is physical measurement of size of surface lump versus laboratory measurement? Why is it important to know how to measure physically the size of a surface lump? What are the different methods of doing physical measurement of the size of a surface lump and how to do them? Are size measurement using physical methods and laboratory methods give the same results? And what are the quality goals in the physical measurement of size of surface lump? Takeaway in relation to patient empowerment: be always in touch with reliable medical information and how to physically measure size of surface lumps. Knowledge is power. It gives power. Use the 4Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on how to physically measure the size of surface lumps as part of your health management. With that, I end my pep talk today. I hope I have empowered you to have a basic understanding on how to physically measure the size of a surface lump in your health management. So before we go to the QA portion, reminder, after this pep talk, take the OLETE for Mastery of Learning and have a perfect score to get a certificate like this. I have placed the link in the chat box. And then another reminder, obtaining 25 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum. And before we adjourn, thank you. Let's now have a group picture taking before we start the QA and interactions. Please turn on your video now. Show your beautiful faces.